Today, it is a great honor and privilege.
Be in good health means to me to have balance, to be able to be present in every situation.
Black people have the highest rates of HIV in the country. We only make up 5% of the population, 25% of all HIV cases.
Challenged by systemic barriers.
I like that question. So you clearly you've seen the TAIBU logo. You know what it looks like.
Yeah.
So you know the two hands that are right next to each
Yes.
other. That's how I knew that this was my space. So again, my grandmother used to always laugh.
C'est des questions que toi aussi tu peux très bien répondre.
Mais c'est moi qui demande les questions aujourd'hui.
Merci beaucoup à Liben. Je pense que la séparation de famille et des familiarités.
First, thank you, Liben. I'm happy to be here. It's always good to have conversations with you.
The Be in Good Health show in honor of Denise Brooks.
And that the people with the highest risk were going to be Black and Indigenous people.
This is a platform dedicated to discussing and advocating for the physical, mental, and social well-being of the Black communities. Welcome to the continuation of our podcast, the Be in Good Health show in honor of Denise Brooks. Our podcast team has been working hard behind the scenes to bring to you a high-quality show with experts in Black health and wellness. And we are excited to share with you the conversations that we have been having along the way. If you haven't already had a chance, be sure to check out our first episode of this podcast, in which we had the opportunity of learning about Denise, her life, who she was as a person, and her family. In episode 2, we will be focusing on the challenges that Denise faced and the resilience and persistence that she displayed in the work that she was doing. And so, I'm very pleased to introduce to you 4 individuals that I have had a conversation with in this episode. Simone Atungo, who is very well known in the CHC sector, was a personal mentor for me, was the ED of Parkdale Queen West CHC, the ED of Vibrant Healthcare, and is now the Associate Deputy Minister in the Ministry of Labour in Ontario. I also had a conversation with Adrianna Tetley, who was the CEO of the Alliance for Healthier Communities, also known as the Association of Ontario Health Centres. I had the privilege of having a conversation with Honourable Gelinas, who is the MPP for Nickel Belt, also the health critic in the Ontario government. And lastly, I had a conversation with Her Worship, Andrea Horwath, who was previously the leader of the NDP and is now the mayor of the city of Hamilton. We've had some good conversation. Let's hear what people have said about Denise's challenge, her resilience, and her contribution to health equity in the province and across Canada. Let's start with how they met Denise. But how did you and Denise meet?
You know, I encountered Denise when I first came into the community health center sector many years ago. And as you mentioned, at that time, I was the executive director at Parkdale Community Health Center. So that's like 20 plus years ago. I know I'm dating myself, but that's okay.
Young.
With age comes wisdom, right? So I'm owning it, I'm walking through it, you know, and just enjoying it at this period in my life and my career. So, you know, Denise probably found me, is what I'd like to say, because, you know, when a Black woman shows up on the scene, Denise is going to make a point of seeking you out, of just, you know, bringing you in under her wing. And that's what she did to me. So, you know, as a little sister, quotations, you know, I think she just took me under her wing from the get-go. You know, I would say probably immediately after I arrived there, made the connection. She did the reach out, made the connection. And, you know, from there, we just forged a long standing relationship. But I was particularly just in awe of this woman who, in the first place, would even seek me out to, you know, invite me into her space, her conversations, the work she was doing, the passion, right? The excitement. I mean, you know how Denise did her work. It took a lot from her, don't get me wrong, because, you know, this work was, as I say, part of her DNA, working and giving voice to racialized communities, to Black African communities, our experiences in healthcare, the barriers that we face, how to dismantle that barriers, and then sort of really keeping us focused on that mantra around policy, right? And around the importance of impacting and influencing policy. In my role today in the Ministry of Labor as Assistant Deputy Minister here, I hear her voice on a daily basis, right? So if it's not in policy, right, it's not gonna matter, and change is not gonna come if it's not in policy. So that's one of my kind of driving forces as I continue to do the work that I do today. So I was ever so thankful and grateful that Denise found me, and immediately we just hit it off with some of our like-minded objectives around our community and wellness and health and wholeness in our community. And that's where our relationship started. At the time, she was also the chair of the Alliance for Healthier Communities, which is what it is now. It was formerly the Association for Community Health Centers. And, I just also really admired her in that role to the point where she mentored me to join the board of the AOHC and the Alliance, and also mentored me to take on an executive position at the Alliance as well. So, Denise and her phenomenal presence was, felt in my life from the time I started my career in healthcare to even present day in the work that I do.
How did you meet Denise, and what was your relationship like with her?
So Denise and I met in rather peculiar ways. I had been the executive director of the Community Health Center in Sudbury for about a year and a half. I worked at the Community Health Center before as a health promoter, and then in 1996, I became the executive director. Denise had gotten the position of executive director of Hamilton Urban Core Community Health Center, I think a year after me in 1997. So all of there were quite a few new centers opening up in the late 1990s, beginning in 1990s, late 1990s. So the group was getting bigger, and the executive director, we used to get together about 2-3 times a year. Just to share best practice, learn from one another. Anyway, so it's one of those meetings. I think it's in a hotel on the airport strip in Toronto, where all of the executive director, we get together, we have a full agenda and all this. My plane is delayed. I live in Northern Ontario, so I flew to Toronto. My plane is delayed, so I get to the meeting a little bit late. And Denise gets to the meeting a little bit late also. And I think it's her first meeting of the executive director. So we can see that the session has already started. We're both at the back door waiting for a quiet moment to come back in. And the quiet moment comes, and then she cracks a joke about the important people being at the back of the room. I start to laugh a little bit too loud. Everybody turns around and looks at the two ladies who were late for the meeting, coming together and sitting at the back of the room. That's not the reaction she wanted. She wanted to get in there very quietly with nobody noticing that she was late. But she forgave me, and she sat with me, and this is how we met. We both sat side by each for that meeting. She was brand new executive director. As I said, her first meetings of executive director, that was only maybe my second or my third. I hadn't been an executive director very long either. And I would say we hit it off from the first time we met. I felt comfortable with her. I liked her. She made me laugh. She made me happy. And I would say we more or less became friends that minute and stayed friends for 3 decades.
And I believe that you served on the board together, right?
Yes, Denise, we both were at the time, all of the community health center had an association called the Associations of Ontario Health Center. The association still exists to this day, but they changed their names to Alliance for Healthier Communities. You probably know about that. And so the board of director had quite a few people from the field. Actually, Denise became the president of the Association of Ontario Health Center, of our association, I think around 2004. And I followed up. I was the president as she became past president. I became president, but we were on the board of the associations together, I would say, for a good 5 or 6 years, where again, I got to see her in action, see how she worked in a position of leadership for the association. It was tons and tons of learnings for me. Just the way she communicated, the way she did things, the way she structured the agenda, the way she changed the structures of the association itself. It was a huge learning curve for me. She was, when we first started, I came from the health side. I worked in the hospital for 12, 13 years before coming to the community health centers system. She came from, she was teaching anti-racism. And so she came from a different background for me. I knew the healthcare system better, but she certainly knew health equity way better than I did, and was a huge teacher for me.
2004, I was applying to be the executive director of what they then called the Association of Ontario Health Centers, and Denise was the chair of the board. And so I went through the interview process. It wasn't as traumatic as yours, Liben, but she was the chair of the board. And so she became my mentor really, really quickly. It was very clear early on that I could learn a heck of a lot from her. The first thing we did together was governance. And, you know, I know you talked about equity and you talked about poverty, but she was a guru in governance, and she was a stickler to governance. And at the time, the board didn't have strong governance policies in place. So together, through her as a mentorship, we actually developed all of the governance policies at the Alliance and at the Association, and then later the Alliance, that really set the foundation for all those policies that are currently in place. Once we got those governance policies in place, she said, we need to live our commitment to anti-racism and anti-oppression. And so we then went through all the policies again. We brought in Douglas Stewart, a anti-racist consultant at the time, and still doing that work, I believe. Yes. And we went through all of the policies to make sure each policy was calling us to live our commitment to anti-racism and equity. And don't forget, this was back in 2004, 2005, when anti-racism, anti-oppression were not on everybody's tongue, but Denise would speak them. And she was well ahead of her time in terms of speaking those words before anybody was doing it. There were a couple of interesting moments. One was we were going to do a conference on anti-oppression, and we realized we couldn't use that word. No one would come. If we had a conference on anti-oppression, no one would come. So we ended up calling the conference about health equity. And we did it. It was about anti-oppression, but we never actually used the words in order to get people into the room. And even at that point, health equity was a new word for people. So she was just so far ahead of her time in terms of using the words and calling people and challenging people every step of the way. So she really not only I learned everything I knew about governance from her, but she was the one who guided me and became my soulmate through all of the years, long after she was no longer the chair, of being that little angel on your shoulder, calling you and calling you to action or calling you to do things. Or Adrianna, you didn't quite say it strong enough or clear enough. Maybe you should rethink that. And that was just our relationship right until she died. She passed away.
So you also were getting phone calls just like we did. So
yes, it was always that moment. Yes. Oh, Denise is called. Okay, I need to get ready for this call because there was always something she wanted you to either do or to change your language or do a different approach. Or have you thought about that?
So I met Denise a very long time ago. It probably was in the late 80s, early 90s. I was a community activist, I guess you would say, in Hamilton on a number of different issues, social justice issues, anti-racism issues. I chaired the Hamilton Coalition for Social Justice, the Hamilton Community Coalition Against Racism, and I was very active on tenant rights issues. I worked at the legal clinic for a number of years. So my first, I guess my first moment of time with Denise was through the Hamilton Community Coalition Against Racism. We put together a workshop to do some work around anti-Black racism, but particularly at the time, it was organizational change. It was anti-racist organizational change. So it was us taking our obligations, our values, our knowledge and our commitment to this table where we were committing then to go back to our organizations to try to make change. And so Denise was one of the facilitators of that conversation. She was brought in as someone to provide some of the direction and the direct the conversation, the learning, the education, and that was my first meeting with, or my first exposure to. Isn't that funny? Because she was such a force, right? So my first exposure to the powerful Denise Brooks, and it didn't end from there. I mean, we grew some great respect for each other, and through my years in social justice before getting elected, and then through my years as an elected person, as a counselor, and then as an MPP, whenever Denise called me up to say, I need your help with something, or come to a ribbon cutting or come to a celebration, whenever I could, I would be there to support her, because she supported so many people through her life.
Our guests in this episode have a unique insight into Denise and how she embodied her values and principles in all parts of her career, and how she stayed consistent throughout.
For people who do not know, have not met Denise, how would you describe her, maybe in a sentence or two, so that people can really kind of connect with her?
Well, probably what they're hearing from us now, they're getting a bit more of a sense, right? But definitely an icon of a woman, right? A woman of great strength and passion and courage and resilience, and I would say a fierce and powerful warrior woman, right? Is how I would describe Denise. There's a lot of different adjectives there, right? I don't know if that makes up one sentence or two, but I would say someone who also had a huge, huge heart, like full of compassion and empathy. It would not be uncommon for you to go to Hamilton Urban Core Community Health Center and, see Denise at her desk, and, while she's sitting there, she's holding a baby of a client.
Yes.
She's talking to clients as they come by.
As they pass by,
She's talking with volunteers or students about their next, career, opportunity. Like, just a very, very human side to Denise, where she just, cared about people in a genuine way, which you don't really find so much these day and age. But, very humble, I would say, and at times vulnerable person as well.
Yeah, no, thank you. Yeah, full circle. It reminded me of some of those meetings we had in Denise's office, downstairs in the small room, could be like meeting rooms and stuff, and her care, ordering coffee and tea and snacks and lunch for us to make sure that we were fed, and the love and the respect that she had from the communities. I know when she was coming into the building, and we would have, like, the clients would be there in the waiting area outside, and they all loved her. Like, she was not the ED, she was like the mother of that space and the community. So that was Denise. So thank you for bringing those memories.
Denise was a long-term planner and strategizer, and championed the causes of poverty, health equity, policy, anti-oppression, anti-racism, and governance. Our guests share their experience, how Denise fought for these causes persistently and was a trailblazer.
And something that resonates with me from what you mentioned is Denise as a force. She brings this energy and this movement and this motion when she speaks to people, when she engages people, when she's meeting with people. So yes, that is the force. But that force also was faced with some challenges. And I think one of the things I personally learned about Denise was her resilience and her persistence and her strength. Because even though she was a force, she was not without any challenges as part of the CHC sector in the community, advocating on behalf of very marginal, communities that Urban Core was serving. How have you experienced that resilience and persistence in your when you with Denise?
So one of the things about Denise that made her very special is she was uncompromising. She was uncompromising. She wouldn't let you try to, kind of cover things up or use words to take her off the point she was trying to make, or the issue she was pushing forward, or the justice she was seeking for her organization or for her people, in terms of the people that she led, both in community, the folks that were served at the community health center, but also the people who worked at the community health center, the board of directors, the staff. I mean, she was uncompromising, and she fought for people, and she fought for what she believed to be the right thing to do, and she wouldn't let anybody take her off that track. And it didn't matter whether it was a city councillor, whether it was a cabinet minister, whether it was a member of provincial parliament. She was fierce, and that, I think, there's no doubt that she faced a lot of blowback and a lot of negativity. And let's not forget the time. I think it's not the same as it is now. She actually was a trailblazer. Her voice and her force, back to that, really did blaze trails in terms of forcing the conversation and creating the space to have the conversations that needed to be had. And no matter how she was received or how she was treated, she was not going to be deterred. And I just always had so much respect for her.
Yeah, no, it's true. And I think, today conversation seems to be a bit more easier. The language is spread across different sectors, different places, different spaces. You're right. When I think Denise started this, nobody was interested to talk about anti-Black racism or speaking about that. So as a trailblazer, I totally agree with your assessment and your experience as well.
Oh, actually, Denise always worked from different angles at the same time. So if we talked about her leadership role on the Associations of Ontario Health Centre, something that she brought forward is, let's have a look at the makeup of the board of directors of the different community health centers. At the time, the makeup of the community health center boards of director was always the same. You wanted an accountant, you wanted a lawyer, you wanted somebody. So you were really skilled, focused. Yeah. And she changed all of this and basically showed us the value of have people who speak from a lived experience. Make sure you have diversity on your board. Make sure you do. And at the time, like she would encourage us to specifically have a spot on the board of director for people that are Black, Indigenous, or people of colors. Have a spot on your board of director. People with lived experience in poverty. Have a spot on your board of director for people who come from a different background. Yeah. And that changed everything. Once the board gave a voice to basically the people who needed community health center services, there was a massive change in community health center, to the point that under Denise's leadership, we let go of the executive director of the association, put out a call and recruitment for something new, like really turn the page as to this is how we used to do things, like a lawyer, an accountant, and now this is how we're going to do things if we want to be good at serving people who have barriers to access, serving people who live in poverty, who have serious mental health and addiction issues, who come from a place of mistrust, and making sure that each and every one of us had access to the care we needed, no matter who we were, no matter the difficulties in doing this. So this is huge. Like, she was the president of the association at the time. She lived it, and there was a lot of pushback. There's a lot of very good lawyers and very good accountants and very good who expected to be on boards of directors for the rest of their lives, and all of a sudden, no, we made room for other people and change the community health center sector for the better. That was a huge challenge, but she did it in a way that was always supportive, that was always look at the opportunities, plan for this, talk to your clients, try to identify, try to support people to put their names forward. Here's how you do this. And she took our hands and helped us and showed us how it could be done in a way that was respectful, in a way that was not confrontational, in a way that worked. And it did. And it did. Certainly that was huge.
Yeah, no, like when you hear Denise speak, when you see her, discuss passionately about what she really believed in, you feel the strength and the power. But she's also very skilled in engaging people in the conversation and bringing people together towards action. That's something really I also really learned from her and seeing her in action.
Given the impact that Denise had on the CHC sector and the Alliance for Healthier Communities in Ontario, the Alliance dedicated an award in her name called the Denise Brooks Health Equity Champion Award. And it is a great pleasure that I was involved in this process to get the award recognized by the Alliance.
I think the Alliance now has the Denise Brooks
Health Equity Champion Award.
And there are some, elements of that award or criteria of that award that really is about Denise. I don't know if you want to.
I have, in fact, I'm going to take the opportunity to speak to them, and I wrote them down so I wouldn't forget, because the Health Equity Champion Award, Denise embodies all of them. To get this award, you only have to demonstrate one of the four, I think, if I understand it. So it is to win the Denise Brooks Health Equity Champion Award, you have to demonstrate that you've dismantled barriers to equitable health. She was always about looking at systemic barriers. Like, that was the biggest issue at the provincial level, was to look at systemic barriers. You had to champion policies that challenge oppression, address conditions that address social justice, and you had to have a strong commitment to anti-oppression, including racism against Black and Indigenous peoples. So those are the criteria that you have right now in that award, but that, I think, really embodies what Denise was all about. And so I applaud the Alliance for creating that award and keeping that part of the legacy and challenging people. I think the biggest challenge is, how do we find people that embody the same spirit, the same passion that Denise had?
Denise was the first thing in many things. She was the first ED of Hamilton Urban Core CHC. She was the first Black woman ED of a CHC. She was the first Black woman president of the Alliance for Healthier Communities, or what used to be known as the Association of Ontario Health Centers. Being the first in anything brings a lot of challenges, and particularly if you're Black and you're a black woman. With Denise, her credibility was questioned. She consistently faced the lowest budget in the sector, especially factoring the complexity of clients that the Urban Core CHC was serving.
And if I remember, I think she was the first Black woman ED of a CHC.
Yeah, she might have been too, yeah.
Yeah, and I don't know if one of the things that she's always is to bring people together, right, to strategize and stuff. And I don't know when she reached out to you, that was the plan, is to guide, like, I need somebody to be with me and to do this work, right? Because alone is a challenge, but together, that's how we can bring change.
Exactly. This is probably one of the reasons she took great pride when she was part of the TAIBU's recruitment committee that hired you in Liben. Because again, the more, African people she brought into the fold, the better. And, that was at the time, a huge and obvious deficit in the sector, having racialized leadership, Black leadership. And so that's another thing that was really, really important to Denise, to make sure that there was representation at all levels within our sector. And so, that's something that she was very proud that she was able to influence that.
Yeah, yeah.
So I mean, Denise was the first Black woman as an executive director.
Mm-hmm.
Her impact was not just around Hamilton. I mean, you described now, like, even for the association or the alliance now, in terms of building the governance structure, but her impact was also with other member centers and the province.
So Denise, when she was the chair, we started looking at an action plan on, at that time it wasn't called anti-oppression, but it was later be called an action plan on anti-oppression, but at the beginning it was on health equity. And it was, we need to live it. Basically, Denise would say, we need to live it at the association side, and then we need to call our members to live it. And so after that conference I was telling you about on health equity, that was the beginning of creating the Health Equity Charter. And then the Health Equity Charter is a document that all the members have to sign and commit to in order to be a member of the Alliance. And, there were a lot of steps along the way in terms of the gradation of how people lived that charter. But it was her work, that very beginning that today, the Alliance has an amazing health equity charter that is probably the best in Canada. At the time when we were working on it, it didn't even exist. There wasn't anything to copy. And we just did this. And even though Denise, this was long after she was no longer chair, she was that active person in the membership, always calling it. So she was the first one to really urge us that we need to collect race-based data. Long before it became popular, it was, we needed to segment the data, we need to collect race-based data. If we don't count, we don't matter. She was as strong on that as she was on policy.
Right.
And I've heard you guys talk about policy.
Yeah. And I think part of the policy is also putting these systems in place. So the governance, which was important for an association or organization, the Health Equity Charter,
right, absolutely.
that is now the foundation of the work that we do at the Alliance.
Absolutely.
It's very heartwarming to know that it started with her involvement at that level. Was she the first Black chair of the association, maybe?
Certainly in my memory, after her was Simone and others, but I'm pretty sure she was likely the first one.
The first one, right? And then we were talking yesterday with Simone to say that she was the one who pulled her to become a board member and the chair, which is the same thing with me, and tried to push me and encourage me and say, no, you have to go there. This is the systems work we have to do. We have to be at those tables.
So if you remember, it'll be before your time, Liben, but when I came on in 2004, she had just overseen the Renewal Action Plan process.
Yes.
And it was a really hard look at the association and their own structural issues related to racism, especially homophobia, Black racism, and Indigenous invisibility in the organization. And it was through her and that Renewal Action Plan when all those things started to change. But it was a tough time when she was chair there within the membership to help them to recognize and acknowledge what was going on and what needed to change.
Another part that was really tough, as I said, she was I'm pretty sure she was the first executive director of her community health center. They had just opened. The amount of money in her budget was quite low, even compared to other community health center. Like that was a community health center that was targeted on urban core, that was targeted on people that were hard to serve, had barriers to access, and yet she had very little tools to recruit from. In Hamilton, where she was, the salaries she had for nurses were almost like $16,000 less a year than what a nurse would make in a hospital. She did not have enough money to offer a pension plan. She did not have enough money to. So here she was asking people to come and work with people who are hard to serve. I remember her telling me that, like a lot of physicians in Hamilton was quite happy to see Hamilton Urban Core opening, and they were sending people with like chart, at the time it was paper chart that tall, that they did not want to look after them. Oh, go to the community health center, they will be able to help you. But what they were really doing is downloading onto the community health center people who were really complex and hard to serve. And so here she was with very low money, trying to attract healthcare providers to come and work with a clientele that was extremely hard to serve, with no money to offer, no pension plan, no nothing like this. And yet she did it. It was tough. It was tough. And there you can really see her connection to the community. She recruited people who wanted to help people. She recruited people who were ready to work really hard to make a difference in their community. And look at who has worked at the Hamilton Urban Core Community Health Center. Some of them are still there today. And you can see that she knew her community, she knew the people, she was able to recruit with very low. Like, how do you attract people to work really hard for less money, for less advantage but she did it. And I know that it was difficult, but she was very successful.
100%. I think she was very successful. And we also see the success through the feedback and the respect and love she had from the community and the clients that she served. I don't think they saw her as an executive director. I think they saw her as somebody who cared. Probably as many of us have been looking at her as our mother who cared, right? I think that is the kind of respect that she commanded. It's very true. Thank you for bringing that up. That is really what Denise has demonstrated.
I would say, so let's say we had, I would be in Hamilton with her, and a lot of people would come up to her and introduce her, or she would introduce this as my friend. And she had a ton of friends. It doesn't matter if we were in a very poor neighborhood where you could see people who were struggling with mental health or addiction or other life challenges. They would recognize her, they would know her name, and they would call her her friend. That was something that you don't see very often, but you saw that with Denise.
Yes, very true, very true.
In particular, one of the biggest challenges that Denise and Hamilton Urban Core CHC faced was space. The location where they were providing services was not suitable for caring for a community. In order to solve the space problem, community health centers have gone through the capital project process. For Denise, this was the biggest fight of her career. It did not get resolved in her lifetime. She missed it by a few weeks. But it was stop and go, 2 steps forward and 3 steps backward.
One of the battles that Denise really fought continuously, and I think for about 15 years or so, because I remember when I came into the sector, that was one of the fights that she had, was about having a decent space for clients to be recognized as, members of the community, a decent space for her staff, and finally, that progressed. And we're looking forward to this space, the new building for Hamilton Urban Core and the Denise J. Brooks Community Hub. If you would like to kind of share some of the things you probably have, you've worked with her very, very closely on so many issues, and I think the Capital Project was one of them. If you can share your thoughts about the building and the fight that she continued persistently to fight against, and then finally got breakthrough, and now this building going to be, one of her legacies. What does that mean to you, and how should we as a community look at that as well, and the process and the building itself?
Yeah, that's a good question, Liben. I mean, probably heard me sighing as you were putting out the question, because I'm sighing because that was a colossal battle. You knew it, I knew it, people around Denise knew it, and I've never seen someone put together a submission of that magnitude, literally by herself, working day and night, right? Because the work that she did on that capital submission was after hours, because during the day there was the regular day job and the events of running a community health center that she needed to attend to. So many long hours at night, wee hours in the morning, putting together the submission. And I'm telling you, if you see the actual submission, you would think that, if the work was tendered out to some third party, consultant with the expertise that put this together. No stone was left unturned in this submission in terms of just talking about every aspect of that building, but from a very community-centered approach, right? Every space in that building is designed in a way to promote the good health of the community, that the community is deserving of a nice, bright, wonderful, health promoting space to come into, to access services, rather than, we know, for where Denise worked many years, right? What we fondly refer to as the old bus terminal in Hamilton, a building that was in such great state of disrepair. It was unbelievable going into that building, and just everything from mold to leaks. Oh, it was just, it was just very physically, difficult place to see and to be in, let alone provide services to the clients, right? But notwithstanding, that was the space they had over the last several years before the capital project got approved. So sadly, the capital project was approved after Denise had passed away, so she didn't really get that, opportunity and that recognition for that hard work. But, we know that even leading up to the last couple of years, when the capital, battle got intense back and forth with the ministry about the space and the size and all those things, locations was being ironed out. You and I, who were close to Denise, could see the wear and tear, right? Like it was, she was beginning to wear the fatigue of fighting that battle, to the extent where, in one of our private conversations one day, I just put it out on the table and I said, Denise, right? Do you really think this is really worth it, right? Like, look at what's happening to you. Like, you're wearing it, your health is being impacted. And, that was a pretty, provocative thing for me to say, because, Denise was my elder. And so for me to be kind of just putting that out there to say, is it really worth the risk, right? Like, based on just my observation of how she was faring at this point in time. And I asked her, would it not be perfectly timely also for you to think about retirement, right? And we had a long conversation about retirement, and African people in retirement. Do we ever get to retire and go off into that next stage of our lives? We're working at our leisure if we want to, or we're doing things that are relaxing, or vacationing, or traveling, or taking care of, I don't know, grandchildren by that point. It seemed like lots of our white counterparts have that luxury of retiring out and still being healthy and, well to do the things they'd like to do in their later part of their life. And so, asking Denise that question and having that conversation was, something that, was, I felt, sort of a necessary thing for me to do. Kind of like, when you state the obvious, Denise, this is really taking a lot of you. I think you need to kind of take a step back and figure out what's next for you. How about retirement? And, before the words came out of my mouth, she was like, oh, you know what, Simone, I got to get this to the finish line. I got to see this through. You know what? This was all for the clients and the community again, is what she mentioned. And she said to me that, her greatest dream was to just sit in her office in her desk chair in the new building. Right. And I thought, okay, right. So that means, okay, back off, Simone. I'm on a mission here. I'm going to get this done. Right. So that's what she said to me and how she responded. And so, of course, with her passing, I reflect on these kinds of discussions. And, I think about, this is what Denise wanted to get to, right? That chair and that office in the new building. Okay, it was not up to me. It's not up to you. I happen to believe in God. So God, is in control, and life happened how it happened. Unfortunately, she didn't get to have that opportunity, but she certainly got the health center and the community and the clients, all of the way there with just preparing that capital submission in that very nuanced and detailed way, which finally got the attention of the funder so that they would, ultimately fund the building. The building, as you know, is in its final stages now, and just kind of seeing how it has progressed over the last several years and months. Just phenomenal. And they're looking at a move-in date in the early part of next year. Like, these are all like tremendous milestones that are being achieved. But I guess we would all agree that it wasn't for Denise to work in the building or be in the building, but certainly she had a huge role to play in getting it there.
Yeah, I think it epitomizes Denise because it was always about others. I think it's good to kind of know that that was a thing that she really wanted to see, sitting in a healthy office, because I remember her office where she was sitting and doing all the kind of amazing work. But for her to have sat there would have really given her that full satisfaction to say the battle is won, and this is. But she gave that to others to do that, which is what Denise is always about others and has never been about herself, which is some of the things we always talk to her about and saying, hey, how about yourself? A little bit about Denise too. But never. It was always about others. It was always about us and checking on us and checking on me. And it's touching. I think for me, it's very touching.
So for Denise, and I think it was through Nala's work and Nadine, who knew Denise so very well, we really created this vision of the hub, trying to capture what is the essence of what Denise would want in that building. And I think that the first was she wanted a vibrant community hub. She wanted all communities to be able to come in and be part of a place that they feel is their place, that she wanted them to feel it's their place, especially after the decrepit building they were in for so long. She wanted a place that they could be proud of, that they felt was theirs. She also wanted to create a very strong sense of belonging, more than just the building, but that people felt a strong sense of belonging, whether regardless of race, gender, street involved, people use drugs. I mean, she wanted it to be integrated as part of what it was that anybody and everybody, she had envisioned in the community kitchen that people from all different walks of life are working together in the community kitchen. She also wanted to create this different vision for most of the community health centers, in that she wanted to have a collaborative space that people came to the patient instead of the patient having to run from the first floor to the third floor. So they created these hubs where the family would be sitting, maybe the children have a place to play. There's a children's area, and then the mom can deal with her nurse practitioner, her dietitian, her social worker, and the mom doesn't leave. It is the people who come to them.
Yeah.
And they have designed these hubs in this new building to create the space where people come to the patient doesn't move. And then finally, for Denise, the breadth of the program she wanted was holistic health and well-being, all parts of a person's life. Not just, you don't come here just for medical, but you're coming for spiritual, for health and well-being, whether it's physical exercise, whether it's your culture, all parts of your life. And when you ask that question, what does it mean for health? For her, Denise, it's all areas of life. That if one part is broken, then your health is impacted, no matter what part it is. And so she wanted to create this wholesome place that a person could come for programs, no matter what part of their life it is that they are challenged with. So those are the and I really respect Nadine and Nala, who really understood them well, and to pull out that was what drove the design of the building.
Wow. I knew some things, but I didn't know the details of the planning of the space. I think Denise is going to be represented in every aspect of the building.
I mean, one of the fights, as you know, was the capital project and having a decent building for the clients, a decent building for the staff. And now, the last time we saw each other in person was at the groundbreaking. What does that, in your opinion, embody about Denise Brooks, but also as part of the city of Hamilton having something that is recognized in such a way as the Denise J. Brooks Community Hub?
Oh, it's amazing. And I, the one thing that I think is very tragic is that she's not here to see, she won't be here for when the doors open. And in fact, I just met the interim executive director at an event, at the Nigerian event, actually, not too long ago, a couple of weekends ago. And we're excited. I mean, I think they expect to open the doors literally in October, if I'm not mistaken. So that's very quick in terms of the construction, but it took a long time to get to actually funding a building and erecting a building. And I mean, I'm not sure if you saw the old place, the old facility on Rebecca.
Yes.
Yeah, I mean, it was an old bus terminal. I mean, let's face it, it was horrifying. It was very stark. It was not meant to be a place to take care of people. There was a huge parking lot of where buses used to park and where people used to drop off folks that were going to be using the transit system. It wasn't a Hamilton bus terminal. It was for buses that were going regionally.
Yeah,
and so it was big, right? But it wasn't, it certainly didn't feel like a place for wellness to occur. It certainly didn't have the bells and whistles that you would see in more affluent neighborhoods. It certainly wasn't what she felt, and what I think any of us felt was what people deserved in terms of a quality place. And so she fought very hard to get those capital dollars and and to get a established a location that actually treated people with dignity, frankly.
Yeah. No. Thank you.
If the building was built after her passing and it epitomizes her leadership and vision for the community, what other areas of work do we need to carry forward as part of her legacy? Being present at the opening of the Denise Brooks Community Hub, it was an experience that we all felt her presence in the space, the life, the work that she really committed to during all those 2 decades of service to the community. The joy that people felt that her work resulted in this great building that speaks of her and her tenacity, her persistence in getting things done. That was a great experience to have been there at the opening. Even though we missed Denise very dearly, her presence was felt.
If we have to carry forward some of the things that Denise really was very passionate about, and this is part of, personally for us, we really want to see this, but also from an organization perspective, from a system perspective, what areas do you think is something that we should continue her legacy in paying attention to, pushing forward? What would those areas be from your perspective?
Well, they're the ones that we are paying some attention to today, which is around health equity and really, understanding the social determinants of health and how it impacts uh, Black people, people of African descent. I think the biggest thing that, rings through for me when I think about Denise is just, her passion around addressing poverty, right? Like poverty in Denise's mind is just an unacceptable human condition, as you know, Liben, that, no human being should live in poverty, and the racialization of poverty was something that she was really, really a strong, advocate for. So I think that would be important. The importance that, pieces that I mentioned earlier that resonates with me around our ability to shape and impact policy would also be something that, we are carrying forward. And I see a lot of good work happening in that area by you and by some of the other Black leadership within, the healthcare and CHC sector as well. So I think those are things that would make Denise feel very proud that that work is continuing. But, knowing particularly that from her perspective, poverty is the greatest health risk, right? That, our communities face, and coming up with some strategies and working collaboratively with across all sectors to find some solutions to addressing poverty. I look at the present day situation we're dealing with the African refugees, for example. Like that's something I look at those situations and in my mind I think, okay, what would Denise do, right? What would she say is kind of like the first thing we need to do to address this barrier, right? And the obvious anti-Black racism that's manifesting itself there in the way that particular refugee population is being treated, right? So those are the things that, I think would be in front and center for Denise and the work that we need to carry forward. And it's a challenge for us, of course, but I believe that, it can be done, through our collective efforts. And I believe things like, raising awareness, this podcast, being at the right tables, influencing policy are all some of the strategies we need to carry out in order to get this done.
I think, you touched on it last time, but I think especially at the provincial level and the leadership level, not as most of the operational level, because I didn't know Denise at the operational level as much as that, it's her importance of understanding policy. So I want to give an example. This, and Denise was in the background in this, but it was because of how she trained me that I kept the work going, right? And so the government, it was under the Liberal government at the time, was creating a new act for healthcare. And we worked really, 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 really hard. In fact, we actually drafted it to ensure we wanted in the objects. We wanted it in the objects that there would be a commitment to equity in the objects. We didn't get it in the objects, but we got it in the preamble. And in the preamble, it does say that the public health system has to make a commitment to equity and equitable health outcomes. And then there is a statement around francophones, French language services, and Indigenous. It could have been stronger, but we got it into the preamble. And then when the Conservatives came, they refreshed that act. They changed the name, but they left the preamble. And, you think, okay, it's a generic statement. But now every time we want to try and advance equity in some way, we can go to the government and say, it's in your legislation. And for Denise, that's what she talks about. Because that forever, until they change legislation, they're not likely to change that legislation, is something we can use into the future governments. You've made this commitment. How are you living your commitment to equity? So I think trying to understand, because people get very involved in operational issues at a local level. But for Denise, it was about that. You need to change the policy. You need to live it, whether it's a legislation, in an act. If she used to say, I think, if it's not written down, it doesn't matter.
Exactly.
Right?
The quote that if it's not in the policy, the likelihood that it will take, bring any about change is nil.
It's not there. So it's just, I think for me, even though at that time she hadn't been the chair for quite a few years, that impact of what she did carried through, not just with me, but other board chairs. Yeah. Simone followed her, and other board chairs afterwards. That strong commitment to policy and how it manufactures itself. So the commitment to the Health Equity Charter was the other thing. How do we hold people accountable to that? But it's that I think that's for me unique in an executive director from many of the other organizations understanding that importance.
Right. Yeah, and considering equity and poverty issues are systemic. That's where it is. And that was the voice that she always, the loud voice of Denise was poverty and racism and policy. These were the things that she always
governance,
mentioned.
but that ties to policy.
To policy, but governance was also very important. And I know TAIBU has benefited from Denise's input for the board, whether it's through reviewing our governance policies on a yearly basis, coming and speaking to our boards and making sure that policy, governance. This is
live your policy.
Yeah, exactly.
I would say she laid the foundation and showed us the way how to be an inclusive community and the value of making sure that everyone belongs. She had a special training, knowledge, skills to make sure that anti-racism against Black people, she had the knowledge, she knew the different ways that racism showed their ugly heads. And I would say certainly for Indigenous and people of colors, also all of those learning works to show that the systemic barriers that still exist, the personal barriers that still exist, and how this has an impact on each and every one of us, on our families, on our community, on everything that we do. Unfortunately, we still have a long way to go. There are still many systemic barriers that exist. I would say I'm a member of Parliament. A lot of this can be addressed by action of government, and I would say the work that Denise has done, the knowledge that she shared with us, is still valuable and can still be used to change policies at the provincial level for the better. And the sooner we are accepting of all, the sooner we can turn the page on racism, the better off we will be. We've made some great stride, but we're not there yet. Let's continue.
I would like to say thank you to our guests who shared their experience, their friendship, their perspective, and reflections. It is very clear for us that Denise's passion, her commitment was around policy, governance, equity issues, and I would like to ask you, our viewers, to reflect on what you have heard about Denise, her legacy, her challenge, her resilience, her commitment, and consider how you can carry forward, move forward in the workplace that you are in the space that you occupy, around advancing health equity, addressing poverty and racism, and making sure that policies are in place and are being put in place so that the change, the improvement, the advancement that Denise always asked us to act upon can also be part of us, who we are taking this legacy forward. And thank you again for our guests for their conversation with us. And in every episode that we are going to be doing, given that TAIBU means be in good health in Swahili, and the podcast is named the Be in Good Health Show in honor of Denise Brooks, we ask our guests their perspective, their vision, and what it means to be in good health to them. Let's hear their reflections.
So, as you know, TAIBU in Swahili means be in good health. And we also named this podcast show the Be in Good Health Show in honor of Denise Brooks. What does be in good health mean to you?
I would say I look at health as a resource for each and every living being. Health, sure, your social health, your physical health, your emotional health, your spiritual health are all resources that allows you to achieve your dreams, that allows you to live the life you want, that allows you to give purpose and meaning and be who you want to be. For me, health, I know that I'm a healthcare professional and I dedicate my life to this, is something that, sure, healthcare should be available to all of us, But to me, health is way more than this. Health is the resource that allows you to be who you are, that allows you to live the life you want to live with the purpose that you want to give it, with the meanings that you want it to have. And it's such an important resource that if you run into problem with that resource, you should have access to a healthcare system that meets your needs, no matter your ability to pay.
Thank you very much, France. It's always a pleasure, speaking with you. Thank you for taking time out of your busy schedule to share your relationship, what you learned, how you regard Denise. As you know, it's very important for me and TAIBU. She's been part of the force behind the establishment of TAIBU, as you know, and for us to take her legacy forward in continuing the work that she started, in what she shared with us, as you said, the knowledge, the passion, the friendship. And so I really thank you for sharing that with us in this podcast.
I can tell you that I love the podcast. When Denise and I were executive director, I would say not a week went by that we didn't call. When I became a politician, we continue. I would say maybe every 2 weeks, 3 weeks max, we would call. I look at my emails to her or from her. We stayed in contact the whole time. I miss her dearly. I watch your podcast, and it felt really good to hear about what her sister had to share and what others have to share. I thank you very much for doing this. She was a good friend, and this is a great idea.
Thank you very much, France. I do appreciate that. Thank you.
Be in good health to me means health all the way around. So health as your physical health, health in terms of your mental health, health in terms of your social well-being, your access to people who love you and who you love, health in terms of your ability to engage with the broader community, with the with friends and with family in a way that's rich and fulfilling, having all of your needs met in terms of your nutrition and your housing and your prospects in terms of your prospects in terms of your children and what you might be able to provide for them, your health in terms of your own employment or being able to fulfill your own path. And so whether that's education, whether that's employment, whether that's the arts, whether that's music, whether that's whatever it is, whatever makes you fulfilled, whatever makes you feel that you're doing what makes you happy. And I know that sounds a bit cliche, but without inner happiness and peace, you don't have well-being and health. And so it's big, and that's what the community health center model is all about. TAIBU.
Yes. Thank you very much.
To me, to be in good health is to all parts of holistic health and well-being. It's about your well-being. I think I'm working on another project in my own local community right now and helping people understand it's about well-being. Health will come if you're healthy well-being, and health is part of well-being, but I think for me, well-being is the word that captures it the most for me.
Right. And I know from your work, moving away from this medical disease model to the well-being model,
absolutely,
which is also the work that you've done at the Alliance in developing the model of health and well-being. So, so the well-being of communities and individuals is what is being good health.
Absolutely.
Adrianna, I think thank you very much.
Thank you
for this time.
I'm honored to be part of this process.
Thank you.
Well, immediately when I think about being in good health, I think about health as defined, as mind, body, and spirit, right? So that really holistic perspective of health, where being in good health means, that there's a balance between all those things, right? And if there's one thing I could tie back to Denise, her life and her legacy that I've from and try to carry forward, into my own practices in life, is just that constant battle, that constant fight, that wear and tear that she experienced, you know, and the toll it played on her health, as I mentioned. But for me, just reminding myself that in the battle and the constant fight, that, you know, there needs to be an opportunity where we take time apart to rest, right? Because rest is resilience, right? Like, because we're taking a moment to kind of catch our breath or to recover from experience, it doesn't mean that we've given up or we're not still in the fight. So it's something that I'm trying to practice. So to me, being in good health, you know, means all those things, that we're just paying attention, being intentional around how we care for ourselves, our own individual health and wellness, which is priority, because if we're not well, we cannot take care of others. We cannot continue this great work that we're doing around, you know, community building and advocacy and reducing systemic barriers for, you know, Black racialized populations. So that's what it means to me, that all encompassing, you know, and every layer, every aspect of ourselves is well and healthy and whole.
Thank you for being with us and for listening. We do appreciate your time. Please send us your comments and feedback. Follow us on social media for the next episode. And if you'd like to have a guest appear on the show, please complete the survey in the description box below. Until then, TAIBU.
Good afternoon, everybody. So I got to speak loud so I can beat the pan over there, right? So I'm asked to bring it on home. This is the end of a glorious and wonderful day, and I have so much love for TAIBU. I've been involved with this center from, as somebody said, long before it even came into existence, and hopefully I've been able to contribute a little bit of something along the way. So I just want to say that TAIBU is a living example of the distributive justice. That's what we call equity. It's about taking some of those resources, some of those things that we need to be able to survive, and putting them where they've never been before, so that we can all stand at the same height on the chair, that we're not having some chairs a little bit higher than others. And I think that the fact that this has happened in a TAIBU is something that we haven't yet quite come to understand in its fullness yet. Lots of great stories today, and lots of great things have happened so far, but we still have to raise our vision just a little bit more. So I'm going to tell you just a couple of seconds, because that's all they ask me to do, is just, you know, build on all the things that happened today, Denise, and bring it on home, like going to church, right? So, and I think that if you agree with anything that's being said along the way, instead of clapping, I want you to say, Ashe, because Ashe means like, that's it, it's done. Yes, amen, I agree, okay? So can you say Ashe? Ashe. All right. So I come from a family that has been here for a very long time. Generations we go back. And every time somebody says to us, so where are you from? We add another generation just to make them mad. We trace our roots through the Underground Railroad. We come, we know, from somewhere exiting out of any of those points that left the continent many years ago, through the United States, up the Underground Railroad, and into Canada. That means I come from a long line of fighters. People who were revolutionaries, who were freedom fighters, people who did things that none of us have been called on to do before, and never knew how they were going to do it, and had the vision and the tenacity to still do so. So therefore, I have a responsibility to carry on, to keep on keeping on, because somebody did when others could not. And that's what I think about TAIBU. I think that TAIBU has a great responsibility. Its shoulders must be very, very broad, because it's a way maker, because it has been a pioneer, because it carved out the very first when no one else could. Many, many hands made that happen. Many people came together behind the scenes, spending days and minutes and hours and sometimes even just seconds, but they all contributed to making TAIBU come into a reality, to making it so that we could be here today and we could be talking about this wonderful celebration. So when I think about the journey of my family, and I think about what it took for us to get here today, and I think about the vision of where we want to be, because we're still trying to find out where we came from. We still want to know the original name, the original language, the original context. We still have that vision because we know something, and that is that that if you understand from whence you came, you sure as heck will know where you're going, and you have something to build on. And I think about that when I think about the young kids around today. And I was surprised. There's two things I'm surprised. First of all, about Liben's new title, because I didn't know that that was his new title. We always have this thing going on. And that Chris is a youth. Like, I was shocked that Chris is in the category of a youth. I remember having some conversation, and people were saying, now that, we have the elders sit on this side, meaning elders with great respect and senior, you brought some wisdom, and the youth on the other side, the younger folks, the younger people, the young adults. So I quite politely took my brave self and sat down with the youth and the younger people, because I certainly couldn't have been an elder. And the youth got up from me and went and sat on the other side. I said, well, yes, you are. So I took that to mean wisdom instead of, age. But anyhow, I think that if some of the youth knew the things, if they knew that we sat from ancient civilizations, that we were the creators of writing and of science and of math, that we stood a journey where millions were lost in the sea, but a million more survived. If they knew that history, they wouldn't be walking around with their pants dropping down looking hopeless. Ashe. They would not be looking like they didn't have a future. They would be looking like there's hope, because they would know that they came from a long line of people who stood fast and stood tall and marched forward even in the darkest times. That's why a TAIBU is important, because somebody has to remind us of that history. Somebody has to lay the way again so that people can find their way. And when you know that, when you know that, when you know that you know that you know that you know, then for sure you're on the road to wellness and healing and all of those things. And that means that TAIBU's job is big. It means that it's set the way not just for here but across the country. Can you see it? It means that TAIBU is going to have to be the leader in research. Do you understand that research is done about you but not with you? That the things that are being prescribed are not with you in mind. They're not manifest how you are manifest. They're not made for how you are made. So TAIBU has to put its head in there and lead in research as well. Can you say Ashe? And the way in which we see programs and services, the way in which we gather together, the importance of the fact that it takes a village to raise a child. And how do I mean that? Every single time we hear something in the news, tell me that Navy man who was just shot up the yard there the other day, everyone didn't say, oh my God, it's a black man. We feel a sense of collective guilt and collective responsibility, and therefore we should also have some collective action towards making sure that things happen. TAIBU has a role to play in helping that happen. Ashe? So we're going to sit on those things, and we're going to call on TAIBU as we leave here, and we heard today all of the wonderful things, all of the great things that are going on in the programs and services, and we're saying that we're going to call TAIBU into further existence. We're going to call them to a higher platform, to a higher purpose, to something that's even greater than where it has been right now. And where it is right now is really, really great. Trust me. Ashe? Ashe. Okay. So I just want to encourage you, because I'm not taking long. See, I'm ready to go. I'm out of here. I finished talking, and hope everybody's like fired up and ready to go, as our man Barack said, right? Fired up and ready to go, because we need something to sustain us. It's nice to come here today, but we have to plant those seeds in the future. We have to make sure that while equity is realized here, that we are all over the place. We're not just only in Melbourne, we're in other places, and there's more people still to come here to TAIBU. We have to make sure that it's entrenched everywhere. We must make our mark so that it becomes indelible and duplicated. So I feel that, because I gotta tell you, I was on the committee that hired the band, so I feel really strong about that. I said, boy, I don't know if people understood at that moment with Chris, and even Sheldon was on the committee, and other people, and Liben was on the committee. There was a conscious decision at that time, and that was following the summer of the gun and the this and the that and everything else, that somewhere, somebody needed, on top of having a wonderfully qualified person, that even from the Voices of Ethiopia, that we needed to have a picture of a black man doing something positive, doing something constructive, doing something that others could follow. And he chose that not just because of that, but because of that and the fact that he had the skills and the talent. And I know that maybe some of us don't want to say that out loud, but we need to be able to do those things to make that demonstration. That's what makes a difference here. That's what makes a difference to people seeing a different vision, because he's the first Black man ever in the history of community health centers to ever have that leadership position. To have any idea of what that load is like, it's a heavy load, and you don't have to do it alone, but it is a heavy load. And those are the things, that's why I'm saying these are way makers. You're carrying the first Black community health center with the first Black executive director in the CHC movement in Ontario, and maybe even across Canada. Okay, that's important. Ashe. Okay, so I just wanted to encourage and inspire the people of TAIBU. I'm always here. Well, not always so lately because I'm kind of busy getting my kicked in Hamilton, but I'm here a lot of the time, and thank you very much. I do appreciate it. I really do appreciate the support. I wasn't expecting it, and I'm very, very humbled by it. So thank you very much. My whole thing is around TAIBU today, and always, because I see the importance of it. I know it. We're partnering around things wherever we can, and just supporting one another wherever we can. And I want to encourage the people who are here. Sometimes we can't see beyond where we are because we're so involved and so engaged, and sometimes the burdens are a little bit heavy, so it's hard for us to raise our vision and look a little bit further. But I want you to know that everybody who's here, you're part of something that is so much bigger than where you are. The vision is so much further than where you can see, and the goal is so much greater than you can ever imagine. So I want to encourage you to continue to contribute, encourage TAIBU, and as we're leaving, sitting on those civilizations that have brought us forward, I'm going to leave you with the words of peace coming out of the ancient Egyptian language and say to you today, Horwath.